approximate normal range of motion for radial deviation? 50 to 20 degree. What is the range of ulnar deviation? 30 to 40 degree. The articular surface of the head of the humerus form an arc of approximately how many degree? 150 degree. Angle of torsion 30 degree. What is the specific movement caused when the arm are raised from the side of horizontal position? Means 90 degree. It's abduction. तो को पता होना चाहिए 0 to 50 degree abduction by supraspinatus, 50 to 90 by deltoid muscle और means के middle deltoid and above 90 serratus anterior. Within the medial collateral ligament of the elbow, which specific group of fiber originated from anterior medial epicondyle are turned from 90 degree of elbow flexion to full flexion? Anterior fiber. Significant weakness of the elbow flexor muscle such as the brachialis and biceps may result in which abnormal position of elbow? Hyperextension. Which of the following accordingly describe the close pec position of the radiohumeral joint? 90 degree flexion, 5 degree supination. In the condition known as clumsy paralysis, is the anatomical site of the lesion is located lower trunk of the brachial plexus, C1 and C8 to T1 nerve root. And what is the Erb's palsy? It's the upper brachial trunk of the brachial plexus injury. The establishment of the resting membrane potential is primary a result of which specific ionic concentration? High calcium and sodium outside of the cell, in high potassium and large ions means protein inside. What is the fundamental physiological purpose of the sodium potassium channel? To reproduce and maintain concentration gradient of sodium and potassium ion. Which cellular mechanism is the responsible for maintaining the high extracellular sodium level relative to intracellular environment? The sodium potassium pump. What is term to describe transport glucose? जब सोडियम पोटेशियम होता है तो सोडियम पोटेशियम पंप, पर सेकेंडरी ग्लूकोज और प्रोटीन इन्वॉल्व, इट्स मीन सेकेंडरी एक्टिव ट्रांसपोर्ट. The resting membrane potential of cell approximately minus 70 millivolt is primarily maintained by sodium potassium pump. Which of the listed structure is the large in structure hierarchy of muscle? तो myofibrillin, muscles, फिर fasciculus, fiber, myofibrillin, sarcomere, myofilament, protein. The radioulnar joint, proximal and distal radioulnar joint, both in pivot type radioulnar joint. Okay. Long head of the tricep brachii, muscle weakness. So status in insufficiency, elbow is held in extension and shoulder is placed in which position? So hyperextension. Which ligament is subjected to the greatest amount of tensile stress during the late cock-up or backswing phase of the throwing the arm? So during vagus force. Surgical reconstruction of the rupture of MCL. The athlete caused Tom Jones surgery. Identify the ligament that extend from to inferior edge of ulnar radial notch and insert into the neck of radius. Quadratus ligament.